Hey guys, so today we're going to be talking about complex level cancer practice questions. So this is for people that are in the complex course, that are learning about all the different types of cancers. And as much as it may seem overwhelming, believe it or not, there used to be more. So as we're going through these questions, the point of this, I don't have time to go through every type of cancer, do a question on every type of cancer. More so, the point is to break down the different types of cancer questions you can have. And you can have questions about risk factors. You could have questions about specific cancers. You could have questions about cancer in general, cancer treatment, therapeutic communication, managing complications. There's a variety of questions. So hopefully we'll kind of more break down like what are some of those questions you might get, the types of questions, and what are some strategies to approach for them. So let's go ahead and get started. Question number one. A nurse is caring for a client with terminal lung cancer. Which of the following assessment findings is most indicative that the client is experiencing superior vena cava syndrome? So first I have to kind of really look at what is this question asking me. And so it's talking about a client with terminal lung cancer. Now in some questions that's going to be important because knowing whether they're going to recover or not it can be helpful. And also sometimes knowing the type of cancer can be helpful. But this question seems like it's more just asking, hey, which of these, like it's kind of like two separate things. Like, hey, this client has lung cancer. They may have superior vena cava syndrome. How are you going to know as the nurse? So really what it's asking, and it's not even asking what is a symptom of superior vena cava syndrome. It's saying what is most indicative. So this is asking like which of these answer choices is most closely tied or connected to superior vena cava syndrome. Now, if I didn't know what superior vena cava syndrome is, I could try to think about, okay, what area is affected? It's like a blood vessel up here in the chest. But some of these answer choices would make that kind of hard to narrow down. So hopefully I know something about superior vena cava syndrome. So let's look at our choices. Shortness of breath. Now, for A, now that's a pretty good distractor because a lot of students might choose this one because they're thinking, lung cancer, something going on up here in the chest. But is it the most specific thing? Like when we think superior vena cava syndrome is our first thought, oh yeah, they're going to be short of breath. Because when it says most indicative, we're thinking hallmark symptoms or symptoms that are going to say like, man, that's most likely superior vena cava syndrome. Their shortness of breath could be related to their cancer, or it could be related, shortness of breath is not closely tied with superior vena cava syndrome. It's more of superior vena cava syndrome, if you don't remember, is like an obstruction. So it's like a blockage where fluid starts backing up, and it starts backing up into the neck, and it starts backing up into the face. So really, I'm looking for something that's showing some sort of swelling in the face or in the neck, backup of fluid, etc. Increased blood pressure. Well, that could happen. But when I sit there and I'd be like, oh, they have increased blood pressure, it must be superior vena cava syndrome. I don't really connect those two things together. So more than likely, this is not the correct answer here. Decreased urine output. Well, that's not good either. I definitely don't want that to happen, but that doesn't seem as specific or as related to what do you call it? Them having superior vena cava syndrome, which leaves me with D, jugular vein distension, which is a common manifestation of superior vena cava syndrome. Because remember, I said it's like there's an obstruction here. So there's a backup of fluid into my neck and in my face, and they have edema and stuff like that in that area. So D is the correct answer here. All right. So I know that this is a breast cancer question. And after I wrote it, I went back, I was like, oh, wait, they're not covering breast cancer anymore. But I still wanted to leave it in because I want to show you this type of question. So even if this type of cancer is not on your exam, I'm going to talk less about knowledge and more about how you approach a question when you get a med question on your exam related to cancer. So it says a client is prescribed tamoxifen after transitioning into remission of their breast cancer. What statement by the client indicates that additional teaching is necessary? So first, there's like all cancer meds have crazy names. There's a lot of like monoclonal antibodies, there's like chemotherapy agents, and they all have crazy names. They have a lot of X's, Y's, U's, W's, and like other crazy letters that don't seem like they should go together. So at least if you know that, say like, oh, that's probably a cancer medication, Sometimes or sometimes medication questions, you have to know what the med is. And this is one of those, you have to know the side effects of the meds. But there's going to be other ones that are going to be asking more in general. So sometimes you can use general test taking strategies. Like, for example, if there was a question that said, hey, how am I going to know this med was effective? And if you're looking at the answer choices and 3 of them are all going in the same direction. Like, for example, I was doing this in one of my cohorts the other day. There was a question for endocrine asking about, like, hey, how do I know that a medication is effective for SIADH? So I don't even have to know the med. If I know what I want to happen in SIADH, then a lot of times I can look at the answers and say, okay, well, I don't know this med, but what am I hoping for to happen? Like, what's the problem? So sometimes if you just know the problem, you can narrow down or look at your answer choices and see which ones are going to support what I'm hoping for this client. So even a simpler one is just like heart failure. Like, let's say that, I had a heart failure question and it was like, hey, how am I going to know this med is effective? If I know what I want to achieve in heart failure, like less fluid, better cardiac output, a lot of times that's going to help me. So even if I don't know every med, if I know overall what I'm trying to achieve, that's what helps. So a lot of times if you're ever like looking at a med, you're like, oh my God, I'm panicking. I don't know this med. Maybe you don't need to know it, or maybe you have enough knowledge about the condition. So a lot of times, like if I'm sitting here, like let's say I didn't know what tamoxifen is. It says they're prescribed tamoxifen and that they had breast cancer. So I'm going to assume it's related to something to their cancer, since they're mentioning it in the question. So if I know something about breast cancer, then I may still be able to answer the question. So in other words, don't panic, take a breath. You might actually be okay. And then, read the whole question, because sometimes the question isn't even about the med. They're just throwing it in there to freak you out. So don't freak out. But anyways, this is a general med question. And this is one where you do have to know the med because it's asking you teaching for this medication. So for this one, I would need to know kind of what are some of the side effects of tamoxifen. So the first one says, and remember, it's also asking additional teaching is necessary, which means which one of these is wrong. So 3 of these are right and 1 of these is wrong. It says, I should report unilateral leg swelling or tenderness or sudden shortness of breath. Well, that sounds like they're trying to say that maybe the patient on this may be at risk for blood clots, things like that, or like a pulmonary embolism. And, if I didn't know this med, I would know that it's probably something hormonal if it's breast cancer, and that people that are on different hormones are at higher risk for blood clots. So, that sounds reasonable. I like that one. It sounds like something I would teach. All right, I'm going to move on to the next one. I may experience more frequent hot flashes while taking this medication. Well, that definitely seems like it could be true, going back to the hormonal thing, because, if this is something for hormones can cause hot flashes. Okay. I will need regular eye examinations and to report impaired vision. Well, I don't know if this medication can cause impaired vision, but it sounds pretty good. Let me check what my last one is. So I'm down to C and D. What's D? This medication will be taken daily for the rest of my life to decrease cancer risk. So here I need to know, hey, do I need to tell them to have like regular maintenance? Are they going to take this for the rest of their life? And so I'd have to know something about this med. And this med is not taken for the rest of your life. It's only taken for 5 years after when you go into remission. So the correct answer that's incorrect is D. They only need to take it for the next 5 years. But if I didn't know that, then I would, if you ever get down to 2 and you're like, what do I do? You just have to think about, what do you think would be most direct, or sounds most helpful? And so, there's very few there's very few meds that you learn about for cancer that they're going to take for the rest of their life. Like, hey, you're going to take this regularly for the rest of your life. When it comes to like maintenance medications, when you're like, just as a whole thinking about it, it's kind of more one of those extreme things. Like, hey, are you going to have to do this always, forever, every single time? Like a lot of times, like we don't live in a world of extremes. We usually do want people to take their medication, yes, but it would just really come down to thinking about whether they would need a medication to prevent breast cancer for the rest of their life. So, even you can kind of use that strategy. I know that strategy won't work for every question, but maybe that'll help you sometime, that you can think of it with the extremes, or you can even think which of these sounds reasonable. All right, let's go on to the next one. Question 3. A client is receiving external radiation and complains of cracked and itchy skin. Which direction by the nurse would be most helpful to help relieve their symptoms? this is asking about like treatment complications. So I need to know like what I can do as the nurse to help this client who is having itchy, cracked, and dry skin. Um, so, and it's not asking me what is helpful. It's saying what, or just like which will help. It's asking what is most helpful. So let's go through these and kind of see this. So, if I had any knowledge about complications of external radiation and just dry skin in general, I would say that we want to stay away from stuff that's going to break down the skin or, make that itching worse. So let's see. So A says the itching can be improved by scrubbing the area with warm water and soap. So I know as a whole, like I'm just going to think in general, if I have cracked and dry skin, like, probably scrubbing it is not going to be helpful. That sounds like it's going to make it worse. They probably want to use more gentle stuff. And I know like a lot of times with radiation stuff, they want to make sure that we're not using too much soap or we like a very mild soap. B says the dryness can be improved by taking hot baths or soaking skin in hot water. So the heat, I don't really like the heat because I mean, I like the moisture, but I don't really like the heat because hot makes things break down even more. I don't think you want any temperature extremes for dry, cracked skin or itchy skin. So in the hot, if they're itchy, the hot probably would make it worse. I don't like that one. C says your skin can be improved by applying moisturizing lotion to the skin. Well, I mean, that sounds pretty good. I like that one. That's the best one I like so far. D says apply cold washcloths to the skin to help improve the dryness of the skin. So I think this goes again. I don't think that we want any temperature extremes. We don't want too hot. We don't want too cold. And so I think the best answer here is going to be C, which is correct. So this is a good, just for knowledge wise, it's really good to have to avoid temperature extremes in a patient has dry, cracked skin. You want to apply moisturizing lotion. You can also apply like aloe vera, stuff like that as well. You don't want to do any scrubbing and you want to use really mild soaps. You want to be very gentle with their skin. A lot of times we need to keep their skin covered, like long sleeves and stuff like that, and making sure that we keep it moisturized and avoid irritants. All right, question 4. A nurse is caring for a client with multiple myeloma. That's bone cancer. Which of the following orders is priority for this client? So this means that they may need all of these things, but which one do I want to do first? So it's a bone cancer. Let's see here. It says provide oral care every 4 hours. Well, that sounds good. I mean, I don't know if they're going to have a lot of vomiting or nausea or anything, but oral care is always good. But it seems more general because when it's saying priority, if it sounds like something like, hey, this is pretty helpful, but not necessarily the first thing that I need to do. Oral care, I'm not like, oh my God, quick, get the oral swab. So yes, let's keep going. And sets up spirometer every hour. Sounds like another general intervention. Like I really want to make sure that I am, make sure they're taking deep breaths and things like that. But is it as important as maybe something else? I don't know. It's not as direct to me for bone cancer. Serial skin examinations. Now this doesn't seem to have anything to do with multiple myeloma, maybe if they had skin cancer, but that's the key here is if you don't know what multiple myeloma is, you could easily get kind of caught up in that. The answer choices in like what's the following orders, which of the following orders is priority? Like in a question like this, we can either put answers that are correct but not the best answer, or we could also throw in incorrect answers. So this is more of an incorrect answer. And then it says normal saline 100 mils per hour. So this seems a little bit more specific because if you don't remember, if you're not sure, if you don't know a lot about multiple myeloma, fluids and hydration are super important. They have their bones break super easily and they can have hypercalcemia as a complication. They're also at risk for having some fluid and blood loss and things like that because of the break of the bones. So as a whole, fluids are key and we like to keep them well hydrated, which is going to help a lot for this patient. So D is the correct answer. So keeping those fluids going what do you call it? A little other strategy here is that some students will ask sometimes, they're like, oh, well, I wasn't sure if 100 was enough or 100 was too much. Now, a lot of the times with an answer choice like this, it's just a random number, but sometimes the number does matter. In other words, you need to pay attention to the number. So like, for example, maybe provide oral care every 4 hours let's say it was the right answer for, this question. You have to pay attention to the four, because maybe it's kind of correct. Like, for example, I know in adult we've had questions before where we talk about, like, hey, with TPN, how often do you need to check a blood sugar? And if it said like every 8 hours, that would be correct. Yes, we need to check a blood sugar, but we need to check it more often. So you do need to pay attention to the numbers here, because the numbers could trip you up. But usually, most of the time, we're trying to make, we do want you to pay attention to detail, but it's more like for this question, it's less about the amount of time or the numbers as it is which of these orders is actually most important. So in other words, what I'm saying is always look at what the answer is, but also do take into consideration that number, because your professors may try to trick you and put in a order that's correct, but a number that's incorrect. So question 5, I know we're tricky. A nurse is caring for a client with cancer who is experiencing pancytopenia. Which interventions are most appropriate for this client? Select all that apply. Ooh, your favorite. So, pancytopenia means I have a low number of blood cells, of all blood cells. That means I have, this question's really asking is, what do I do to treat, what do you call it, neutropenia? What do I do to treat thrombocytopenia? And what do I do to treat anemia? So which of these is going to help with those three things? Because pancytopenia is I'm low in all my cells, white blood cells, red blood cells, and platelets. So use a soft bristled toothbrush. So if you didn't know what pancytopenia is, or if you thought it was just neutropenia, you could get confused here and say, oh, that doesn't really apply. But what does soft bristled toothbrush apply to? It does apply to something. It applies to low platelets. If you remember, all of your fun bleeding precautions that we learned about back in cardiac, your favorite section. So again, we're going to go down here and go true, false. So far we have A as being true. I'm going to teach them about the soft bristled toothbrush. Remove fresh flowers from the room. This sounds like something related to infection. Anytime you see the word fresh, think, like I want to keep the fresh away to keep the infection away. So fresh flowers and fresh fruit, I do not want in the room. So B is also correct. That's something that I want to keep out of their room, because fresh flowers can be a place where bacteria can grow. Maintain the client on bed rest. Well, some students may get tricked by this one and say, yes, I want to keep them on bed rest so they don't fall and get a bleed in their head. So that might be true, but there's nothing, they don't have to be on bed rest to prevent infection, to prevent the issue with the platelets, or with anemia. So, because like movement and stuff may actually really be helpful for them to prevent types of infections, like preventing pneumonia, getting up and moving around. So, in other words, when you're looking at this one, yes, it's a stretch, but you have to remember the question asked just not what is appropriate. It says what is most appropriate for this client. And so they don't have to be on bed rest just because they're pancytopenic. They can get up and walk around the room. Now, if this said more like encourage the client to avoid crowded areas, absolutely. But it doesn't say they're going to a crowded area. It doesn't say they're going anywhere. It's just saying, do they have to stay in their bed? Is there anything about being pancytopenic that requires you to stay in your bed at all times? And there really is not. So I'm going to say incorrect for that one. Then D is turn the lights off and keep noise to a minimum. So this seems like decreasing stimulation. Now, while as a whole, a patient that is has cancer, they may have other symptoms like nausea, or they may not be feeling their best. They may be fatigued and weak. This might be a good general intervention for a cancer client, but it's not going to affect their it's not going to give them a higher chance of getting an infection. And keeping the lights off and keeping the noise to a minimum is not going to stop them from bleeding with their low platelets or change anything with their anemia. So I'm going to say also incorrect. Monitor complete blood counts daily. Well, this seems pretty important. This is something I need to monitor to see how it's going. Are they still neutropenic? Are they still thrombocytopenic? Are they still anemic? So I think monitoring that daily, that sounds appropriate. And like I brought up in the last question, you always want to see, like, look at like how often do you think is it appropriate to do this? Now, don't talk yourself out of it, because most of the time we don't focus so much on the time. We just focus on the overall picture. Unless your professors, I don't want to speak for your professors, because maybe they do focus on that for some stuff. I'm sure they do. But keep it in mind, but don't drive yourself crazy. If you're sitting here and being like, is it daily, or does it need to be daily, or just weekly, or twice a day, every 8 hours? Like, if you're getting in your head, just think, does it sound reasonable? Just checking it. And like most labs are about once a day. Some other things need to be monitored more frequently, like electrolytes and stuff like that, or blood glucose levels. Check temperature every 4 hours. Well, if they're at risk for infection, I probably would want to do that. I usually check vital signs more frequently in patients that are pancytopenic or at high risk for infection. So that sounds reasonable. So that leaves me with correct answers of A, B, E, and F for this one. Question 6. A client is diagnosed with cancer and tells you, I am not going to get any treatment because I will probably just die anyway. What is the most therapeutic response? So, this is the therapeutic communication question, which these are usually pretty straightforward. We're usually looking for an answer that's going to allow the patient to expand, it's going to acknowledge their feelings and give them an open forum. We don't want to belittle their feelings, we don't want to tell them how they're feeling, or tell them how to feel. We don't want to give them any advice. We want to really focus on the patient. So let's see which answer might be best. A says, have you talked to the doctor about your concerns regarding treatment? And so this does seem like a question like that might be helpful. Like, hey, have you talked to the doctor? But it doesn't acknowledge their feelings, and it also defers to someone else. Like, have you talked to someone else about this? And generally, in these questions, in all nursing school questions, we always want to, unless the question asks you to defer or to delegate to someone else. Usually the question wants to know what you can do as the nurse, like you as your role as the nurse. And especially with the therapeutic communication, we want to know what you can do there to be supportive for this patient. B says, I had a similar experience with a family member and they decided against treatment too. Well, I mean, it's good to connect with your patients, and in real life, you might connect and share your experiences. But first, we really need to let the patient express themselves more, maybe seek clarification on what they're saying. So for B, it focuses more on me and brings it to me versus bringing it to the patient. C says your cancer is very treatable and you should consider treatment. Well, that sounds like advice giving, and I definitely want to stay away from advice giving as a nurse. I really want to open the door so that the patient can discuss and talk about their feelings. Which leaves me with D. It seems that you are concerned about your treatment. You're concerned that your treatment is not going to be effective. So, I know that most of the time you guys think the answer is always going to be like, why do you feel this way? And sometimes it is, but sometimes restating what the client said just to like kind of create an open door um, allows them to kind of clarify. So if I said something like, it seems like you're concerned about your treatment, it's concerned that your treatment's not going to be effective, it allows them to be like, yes, I'm really concerned about it. Maybe open up a little bit more about how they're feeling. So D here is the correct answer. Question 7. A nurse is caring for clients on an oncology floor. Which client should the nurse attend to first? This is actually great because this has 4 different patients in it. So you have to kind of know. I know you're saying this is not a great question. This is great for me as a instructor. I'd love to see you guys answer these because it really helps me to see, can you prioritize it? Can you see how these patients are doing? So a question like this, the way you want to approach it is that there's going to be 3 clients that are either having expected findings, or they're having maybe abnormal findings, but they're not life or death. So this is really helping me to discern as an instructor whether you can see which of these patients is experiencing a life or death crisis, prioritizing, and also seeing if you know what's expected or what's normal. Because some stuff with cancer patients sounds super scary, but it's actually okay for that patient. So A says a client with a new diagnosis of lung cancer who is crying in their room. So a lot of times new stuff, anytime there's a new patient on the floor, new something going on, a lot of times it can be priority. But it looks like that this is more of a psychosocial thing, that they have a new diagnosis of lung cancer and they're crying in their room. Now I know that your heart's probably like, oh my God, I have to see them first. But remember, emotional stuff goes after physical if you go on Maslow's hierarchy of needs. So let's look at the next one. A client with colorectal cancer that is having light bleeding with stools. Okay, well, I think with colorectal cancer, they can have some bleeding with stools. Now, I don't like that. I'm thinking ABC, C for circulation. But I don't know that there's something I have to do right now to go do it. It's definitely something I need to monitor and check in on. So I'm going to kind of keep that in my repertoire. So C, a client who received external radiation earlier and has dry, itchy skin. Well, I definitely want to increase that patient's comfort, and this is a comfort thing, but it doesn't seem like there's any problem right away, like there's like a life or death emergency, etc. And then we have a client who recently received chemotherapy and has a calcium of 7. So I would need to know what a normal calcium is. Um, but this seems like this calcium is low because I know normal's like 8 to 10-ish. And so this calcium's low. So it seems like they could, and low, both high calcium, calcium abnormalities can affect, my cardiac rhythms. And so it seems, and low calcium can also lead to tetany and can also lead to like laryngospasm if it gets low enough. So I'd be pretty worried about someone with a low calcium, and they're not showing any signs of like tetany or anything yet. But overall, I'm between B and D. So I have a patient who has light bleeding with stools, which may be expected for this client. And it says light bleeding. And anytime you're kind of see, if you see like mild, occasional, those are usually signs that something's not as serious as other things. Versus a client who actually has a problem. So you really want to look in these questions for the client who has a problem right now. And we're keeping in mind that, remember also in NCLEX world, that a brand new patient that you haven't assessed yet is always going to usually be top priority because you don't know how they're doing. You don't know if they need anything or if they're stable. So usually you're going to see that new client. I'm not talking about the new diagnosis. I'm talking about a client that's new to your floor, just got back from surgery, new admit. Like those are usually going to be the sickest ones. So you want to look for those first, but then also look for any client that has an actual problem. And as of all these ones, all of them have problems. Some are to be expected, but the only one who needs my care and my help right now is going to be D. So at least first. All right, last one. A nurse is performing a history and physical on a client and is trying to determine their risk for colorectal cancer. Which question by the nurse would be most helpful to ask? So like in my other video, I told you there's a couple different ways that we can ask a question like this to determine risk. We may tell you like, hey, the client said the following statements, which statement indicates they're probably at risk for something or that they probably have a certain syndrome or diagnosis. This one is saying, what question do you ask? So we could ask on both sides. What's the answer? What's the question? So in other words, we're trying to see what kind of risk factors are associated with colorectal cancer. So the first one says, do you have a history of gallbladder disease? Well, it is a GI organ, but I don't really know if gallbladder disease is directly related to colorectal cancer. So I'm going to move on. What kind of foods do you eat? Well, I feel like there's something related to diet and colorectal. So I like that one. And it says what's most helpful. So it says some of these, there might be more than one right answer, but which one's most helpful? So let's keep going. C is, do you have regular soft form stools? Now, this is one that a lot of students would pick. So this is the thing, is it's not asking the signs and symptoms of colorectal cancer. It's asking what the risk factors are, and having loose stools or having constipation doesn't cause colorectal cancer. It's how colorectal cancer shows up. In other words, this is the difference between a question that's going to tell me whether someone's experiencing colorectal cancer or is at risk for it. So regular soft form stools would help tell me whether a person's having symptoms of colorectal cancer, but it doesn't tell me whether they're at risk for it. And last but not least, there's, what was your last hemoglobin A1C? Now, I don't think diabetes is a risk factor for colorectal cancer. So I'm saying I think the best answer here is going to be B, because there are certain foods like a low fiber diet or some meats and things like that that do increase your risk of colorectal cancer. So I think the best answer here is going to be B. Anyway, I hope that this was helpful to get you started in some of these cancer questions. I know cancer is super tricky. There's so many different types of cancer. Start breaking it down, do lots of practice, and I'll see you for the next one. Bye.